The average job search takes 3 to 6 months. It took me 3 months to land my fellowship while I was in my Master's of Public Health and 4 months to land my current role in 2020. About 53% of college graduates are unemployed or working in a job that does not require a bachelor's degree. Even when the unemployment rate is low, it's hard to find a job in public health. It's common to have a hard time finding the right job in public health after graduating. So if this is you, just know that you are not alone. And today we're going to walk through applying to jobs in public health is a numbers game, the state of the job market, tips on staying resilient and the mindsets you need during your job hunt, as well as public health job searching tips. Are you feeling defeated after not getting a job? Whether you're a recent bachelor's or master's graduate, your goal was to get a job upon graduating. It has become increasingly hard in this economy to land the right job. This is all while there are magnitudes more public health graduates today than there were when I graduated in 2019. This is all while the 5-year CDC-funded public health infrastructure grant was awarded. One of the strategies focusing on increasing the public health workforce. If you're feeling defeated, just know it's natural to feel defeated. What's more important is that 1, you detach the job search from your worth, and 2, you create a job search plan which will help you with today. It may take longer than it did in the past to get a job, especially if it's an ideal job you've been looking for. Remember that there are numerous companies that are posting ghost jobs, not ones that are actually trying to hire for them. Just anecdotally, I was speaking to someone who was applying to fellowship positions in New York, and she was telling me that she applied to a slew of different fellowship positions, and in talking to the recruiter, she learned that many of those fellowship positions were posted, but they already had fellows from past fellowships come in and take those positions, so they weren't really hiring for those fellowships. Just wanted to share that this is happening in public health as well, and this makes it all the more difficult, but I got some solutions for you. Applying to jobs is a numbers game. Job candidates on average get 1 interview for every 6 job applications. And just to bring this to public health, because this is national data, in my anecdotal experience, I've gotten probably 1 interview for every 10 applications that I put out. But going back to the national data that's out there, if you do 1 to 10 applications, this gives you a 62% chance of getting an interview. If you do 21 to 80 applications, this gives you an 82% chance of getting an interview. And if you do 81 or more applications, it gives you an 85% chance of getting an interview. So all that being said, you'll need to send out at least 21 applications in order to get an interview and have a high likelihood of getting a job offer. The sweet spot for getting a job is in the 21 to 80 job applications submitted. Your likelihood of getting an interview and subsequently a job increases with the amount of applications sent. Optimize your applications to position yourself to be a strong candidate. If you are struggling to get a job in public health, the answer is persistence. If you are persistent but get no leads, the answer is to improve your application. If you are unsure of how to improve your application, the answer is to tailor your work to the job and include relevant keywords from the job posting. If you tailored your work and improved your keywords, the answer is persistence. If you want to stay persistent, the answer is to find an accountability friend or group. No matter where you are applying, you will all need to have a plan to get a job. The state of the job market. We are in a blue-collar boom and a white-collar recession. While U.S. employment is at a historical low at 4%, there's a recession occurring for the most educated workers and a job boom for the least educated workers. This may explain why it's even more difficult right now to get a job if you have a bachelor's, and especially difficult if you have a master's in public health. In June 2024, there were 8.1 million jobs available in the US economy. There were 6.6 million unemployed persons in the US. There are currently 1.2 jobs available per unemployed person in the US. The population with the least education, i.e., less than a high school diploma, has seen the steepest growth of employment at 5.7%, compared to 2.5% for those with a bachelor's degree or higher, or negative 0.4% for associate's degree or some college, and negative 1.4% for high school graduates to college. In the public health job market, hiring is still happening. I've seen at least 15 celebrations of new jobs in the past week on LinkedIn. What's happening though is that it's likely that taking longer than it did in the past to land a job, and even more so for your ideal job. Remember, there continues to be a shortage of governmental public health workers. While these jobs are available, governmental public health jobs are notorious for taking longer than other jobs for hiring candidates. If you're interested in governmental public health jobs, I would check out websites like publichealthcareers.org and usajobs.gov. Your public health skill set is valued in so many fields outside of traditional public health. So be sure to keep your eyes open to non-traditional positions where you can apply your expertise. And if you're thinking about how can I apply my expertise, join my community and I can help support you in thinking through how to take your skills, experiences, and translate that into different jobs. Resilient job hunting. 55% of unemployed adults say that they were burnt out from job searching, increasing to 66% for younger generations. Burnout can happen to any of us. Developing the right skills and coping mechanisms to combat burnout is essential, especially in public health. Burnout can result from chronic stress, work overload, lack of control, lack of support, imbalance in work life. 3 ways to beat burnout on your job search. 1. Create your structured plan. Reflect and develop a clear job search strategy. Set your goals and timelines. Choose how many jobs you will apply to per week or how many hours you will work on applying to job applications per week. Decrease overwhelm and increase your motivation by breaking tasks into manageable steps. 2. Prioritize and schedule your self-care. Incorporate breaks into your routine. Breaks should be a fundamental part of your plan. Engage in activities that recharge you. Exercise, hanging out with friends, hobbies, meditation, watching movies, whatever refills your cup, do some of that. And schedule your sleep so you get 7 to 8 hours of sleep and maintain a healthy diet as best as possible. 3. Cultivate your support system. Connect with people that offer encouragement and advice. Join our online community or other online communities for networking and support. And get professional help if you feel overwhelmed or stressed. By following these steps, you can effectively manage burnout and stay motivated throughout your job search. Remember, taking care of your well-being is just as important as finding the right job. Embarking on your job hunt can be a challenging and emotionally taxing experience. Here are 4 mindsets you need on your job hunt. To navigate this journey effectively, it's essential to maintain the right mindset. So use these mindsets so you can stay true to yourself and resilient throughout the process. 1. Know you are enough. Despite how you may be feeling in this moment, not having a job, not having successful interviews, you as a whole person are enough in this world. This circumstance does not define you and was not because of you. It may seem tough right now, but you will get through it. Lean on friends who will raise you up. Take breaks, and please be kind to yourself. 2. Know you are not a failure. The systems around you have failed you. Schools should be preparing graduates for careers afterwards. I created this platform because I believe there was so much about public health career development that I did not know and I had to find out on my own. School is hard enough on its own. Schools need to support students better, especially at the cost of higher education. You got where you are despite all of these challenges. You are strong and will make it through. 3. Pause and reflect. Get the negative energy out of your life. Negative energy and sometimes people do not serve you and who you want to become. What did you enjoy during your journey? Can you do more of that? Even in an internship or volunteer level? Practice your hobbies. This is a great time to develop happy habits for yourself. This will also help you realize that you are more than just a job. 4. Detach the job from you. In life, you are more than your job title. Your value exists as a person outside of any job you work in. People often conflate their value from their job to their personal value. Thus, when we have no job, we devalue ourselves. Stop it. You are so much more than any job. The quicker you're able to detach yourself from the job, the better you will be. Jobs are important, don't get me wrong, but you, as a whole individual, are more important. Embrace these mindsets so you can maintain your self-worth and resilience during your job hunt. You are more than your job title, and your value as a person transcends any employment status. Stay positive, stay true to yourself, and trust in your journey. Public health job searching tips. Here's an outline that you can use to structure your job searching process. The 5-step method you must focus on your public health job search are 1. Goals, 2. Optimization, 3. Brand and network, 4. Intentional applications, and 5. Preparing for interviews. This method will set you up for success in the long run. So goals. Set goals and have a plan. Start by reflecting. Reflect on your experiences, on your ideal job roles, on the knowledge and skills you've acquired. What locations do you want to work in? What's your non-negotiable salary needed? What's the ideal company culture? Before applying to jobs, you should have an idea of what you want to do. You should know where your knowledge, skills, and experiences to make you a strong candidate. Also know the skills you want to develop and strengthen in your new role. Set goals for how many jobs you'll apply to per week. Alternatively, you can set certain amounts of time you will work on researching, tailoring, and applying to jobs each day or week. Track your job applications. Save them in a folder so you can recall their roles, responsibilities in depth before any interviews. And find yourself accountability partners that you can lean on when things get tough or you lose motivation. Optimization. Optimize your resume, cover letter, and LinkedIn. Optimization is a must in 2024. Start by creating a draft master resume that you can use to tailor to specific job applications. You should also draft a cover letter that you can use as a template. The most important thing you can do is to optimize for the keywords in the job description. Optimize it to your resume, cover letter, and in a broader sense, your LinkedIn profile. Build a strong 2-page or less resume, unless applying to a federal job. 90% of HR professionals believe a resume should not be more than 2 pages, regardless of how much professional experience you have. Always submit a cover letter, even when a job doesn't ask for one. Cover letters aren't as important as your resume, but can be a differentiator between 2 matching candidates. Don't rehash your resume. Instead, focus on relevant achievements, qualifications, why you are a good fit, and why you want to work at that company. Your LinkedIn profile should have the keywords that most often come up in the job applications that you're applying to. So once you figure out what kind of jobs you're applying to, understand what are the keywords that are showing up across these different applications, and then put those into your LinkedIn profile. More on this at some point. Brand and network. Build your brand and develop your network. Many jobs are secured through some form of networking. Networking is the art of building genuine relationships with people with similar interests and visions. While LinkedIn is a good tool to grow and engage your network is offline too. Develop your network by doing informational interviews, joining professional organizations, connecting with like-minded folks, attending online or in-person events, researching jobs and making connections, intentionally creating and sharing content online, and utilizing your alumni network and other networks. Your brand is how people think of you when you are not in the room. Your brand is how people feel when they interact with you. Whether you like it or not, you already have a brand. So it should be upon you to ensure you build your brand that you want people to know you for. The easiest way to build your brand is by first being good at the work that you do, and then you can also just share content on platforms such as LinkedIn. Utilize LinkedIn to build your brand while expanding your network. Intentional application. Research jobs and apply with intention. From the goals developed in part 1, outline your intentional application process. Apply to jobs if you meet 55% or more of the job description. Stop applying through LinkedIn, Indeed, or other job aggregator sites. Start applying through the company websites. Use LinkedIn to search for alumni and other people in your network that work at companies you're interested in working for. Connect with these people and have an informational interview to learn more about the company and the role. See if they can connect you to their hiring manager or someone on the team you're applying to. This is how you not only network, but is a step towards intentionally applying and networking. After interviews, follow up with the interviewee. Interview preparation. It is better to be over-prepared than to be ill-prepared. For the interview process, you want to research the company, understand the role, prepare your answers, practice and prep your delivery, and prepare to ask your thoughtful questions of the company and their employees. Familiarize yourself with the company's mission, vision, values, services, and broader industry. Review the job description to highlight key responsibilities, skills, and knowledge required. Match your skills and be prepared with examples to talk to any of these. Practice common interview questions. Use the STAR method, situation, task, action, result, to structure behavioral-focused interview answers. Work on technical questions specific to the role you applied to if applicable. Do mock interviews to best prepare yourself. Pay attention to your body language. Make good eye contact. Have a confident handshake. Practice clearly communicating your points. Try to reduce filler words. Prepare and write down the questions you want to ask the company. Have at least 5 of them, but prioritize ones most important to you. Focus your questions on company culture and work environment, role-specific questions such as success metrics, day-to-day responsibilities, and learn about professional development and growth opportunities at the company. Last piece of advice, your past does not define you. There are no failures, only lessons or redirections. Every success story starts off tough, starts off with struggle. Think about the hardest hike you did. Was it worth it? If you are not getting callbacks, which is common, redo your resume and cover letter optimization. Focus on sharing the outcomes from the work that you have done. Give yourself grace. The job market is a tough one. Keep your head up and follow your plan. You'll get that job in no time. Thank you all so much for watching or listening to this. Hit that subscribe button so you don't miss any public health careers episodes or conversations like this. If you are struggling to tailor your resume or cover letter, or don't know how to optimize your LinkedIn profile, or want to better develop your public health brand, or just connect and support the Public Health Millennial, check out our community, the Public Health community. The link is below, where you can join for just $10 a month. Look forward to seeing you there. Peace, everyone.